Dear students and colleagues, non-alcoholic fatty liver disease is a very common disease and characterized by fat accumulation in hepatocytes. The disease activity range from just simple steatosis, fat accumulation in liver. Next stage is non-alcoholic steatohepatitis, which present with inflammation and elevated LT and AST level, and the next stage is fibrosis and liver cirrhosis. Non-alcoholic fatty liver disease is associated with cardiovascular diseases, with major adverse cardiac events like ischemic heart disease, stroke, heart failure, and other. Risk factors of non-alcoholic fatty liver disease is metabolic disturbances, which includes diabetes, obesity, dyslipidemia, hypertension, other comorbidities. And necessary to note that non-alcoholic fatty liver disease present not just in obese patient but can be in lean patient with normal body mass and low body mass. Steatosis or fatty change is accumulation of fat droplets in the hepatocyte cytoplasm and can be classified histologically as macrovesicular and microvesicular based on the size of lipid droplets. Non-alcoholic fatty liver disease is defined as the presence of steatosis in more than 5% of hepatocytes in the absence of significant alcohol use or other causes of steatosis, including viral hepatitis, drug-induced liver injury, and others. Non-alcoholic steatohepatitis is characterized by the presence of active injury, inflammation, and histologically it's a form of hepatocellular ballooning degeneration and lobular inflammation, and predominantly lymphocytic infiltration with neutrophils. This is a slide of patient morphological examination liver in case of non-alcoholic fatty liver disease, and we can visualize combination of large and small droplet macrovesicular steatosis and a small patch of microvesicular steatosis is noted on the right and indicated by black star and characterized by infiltration of hepatocyte cytoplasm. A few balloon hepatocytes are also noted with white arrows in this patient. The next figure is histological data of patient with lobular necroinflammation, and inflammatory cells consist of mononuclear cells, and here present indicate with yellow circle is the area of necrosis which present in patient with non-alcohol steatohepatitis. And this is the same, we can visualize not just fat deposition in non-alcoholic fatty liver disease, but hepatic fibrosis, which caused by excessive production, deposition, and accumulation extracellular matrix by activated hepatic stellate cells and myofibroblast. For diagnosing non-alcoholic fatty liver disease, we use activity score and fibrosis score, and non-alcoholic fatty liver disease activity score includes it's the upper part of table, includes such parameter like steatosis, like lobular inflammation and ballooning degeneration. And you see that if patient has score 1, patient has a lipid accumulation, steatosis less than 5%, lobular inflammation and ballooning degeneration absent. If the score is 1, we see that increase great percent of steatosis, present lobular inflammation and few ballooning degeneration. In stage 2 and 3, elevate grade of steatosis, lipid accumulation in liver, lobular inflammation and many ballooning degeneration present. And if patient has a calculation of points more than 4, this score, we think that this is diagnostic criteria of non-alcoholic steatohepatitis. Plus we have fibrosis score according to histology of liver patient with non-alcoholic fatty liver disease, and this fibrosis score can be from 1A up to 4, and 1A in histology we see mild pericellular fibrosis and only seen on connective tissue stain. And in stage 4 we can see liver cirrhosis. We have non-invasive methods of assessment of liver stiffness in patient with any liver disease, and one of these very informative methods is MR elastography. And here at this slide you can visualize very informative the stages with patient with steatosis, top row, and primary sclerosing cholangitis, bottom row, and different stiffness at this patient, which you can see with white arrows and black arrows in patient with advanced liver disease. The stiffness in patient with primary sclerosing cholangitis very or higher compared with a patient who has just simple steatosis in top row. Necessary to differentiate this histological change with the macro and micro vesicles in patient in liver disease, because we should exclude other clinical situation which can present with a deposition of fats, lipids in hepatocytes. For example, another disease which present with a macrovesicular steatosis are alcoholic liver disease, is a metabolic condition, diabetes, hyperthyroidism, genetic disease like cystic fibrosis, Wilson disease, malnutrition, inflammatory diseases. Microvesical steatosis can be present in acute fatty liver in pregnancy, alcoholic degeneration, genetic mitochondrial diseases, infections, including human herpes virus, toxins, any drugs like amiodarone, valproate, treatment HIV patient can be associated with microvesicular steatosis. It means that necessary to think about complex examination patient with non-alcoholic fatty liver disease, and we can establish diagnosis just when we have not just one histological examination, but and clinical data and lab test and another investigation plus histology. About the treatment non-alcoholic fatty liver disease, we have no pathogenetic treatment. We should manage comorbid situation, comorbid cardiometabolic risk, obesity, diabetes, which associate with onset and progress non-alcoholic fatty liver disease, and we can use treatment obesity, diabetes type 2, hyperlipidemia, but cornerstone of management patient with non-alcoholic fatty liver disease remains lifestyle modification with diet, with physical activity. Recommend to decrease weight in patient with non-alcoholic fatty liver disease at least 7 up to 10% from initial. It leads to improvement of histological indices of disease. Lifestyle modification may lead to resolution non-alcoholic fatty liver disease in 1/4 of patients, 25%, can lead to improvement of disease activity and even to fibrosis regression. For treatment, we can recommend anti-diabetic medication, and for example, pioglitazone we can use for patients with pre-diabetes or diabetes type 2 and non-alcoholic steatohepatitis. Statins, ezetimibe, can reduce the risk of cardiovascular diseases and non-alcoholic fatty liver disease and improve liver function in this patient. Vitamin supplements, antioxidant, vitamin E, C decrease hepatic inflammation and can lead to reduction of level of LD and ST patient. Summarizing all information about non-alcoholic fatty liver disease, you can see at this slide that patient with this disease has any risk factors which can be modified and non-modified, and very important in management patient to explain patient that life modification very important for control of disease. Plus we should exclude other disease like viral hepatitis, alcohol consumption, genetic disease, and this disease very common but has enough favorable prognosis if patient follow all doctors' recommendation and use treatment their comorbidities. Thank you for attention.